Okay, so if you're a sales rep, maybe you know dental, but you're stepping into orthodontics. Feel like a whole new language sometimes, right? Welcome! This deep dive is really the first step to help you kind of decode the main process, the foundational phases of treatment. Our goal today, walk through these steps, keep it simple, and connect it all back to the products you're actually working with.
Yeah, absolutely. And, understanding the why behind what the orthodontist is doing at each stage,
Hmm.
that's so key to serving them well. It's a pretty logical progression, actually.
Right, like building something step by step. So where does this journey usually kick off?
It starts with phase one. That's alignment and leveling. The goal here is really foundational, getting the teeth straight, leveling out the arches. Think of it like preparing the canvas before you paint.
Okay, preparing the canvas. How's that actually done? Like, what are the main tools they're using right at the start?
So in this first phase, they bond brackets onto the teeth. Then the orthodontist places light, flexible arch wires.
Mm.
Very often, these are NiTi wires.
Nitai, nickel titanium.
Exactly. Nickel titanium. They have this neat property where they always want to spring back to their original shape. And that gentle force, that's what starts nudging the teeth into the right place. And to hold that wire in the bracket slot, they'll either use tiny elastic rings, those are called ligatures, or maybe a self-ligating bracket system.
Self-alligating, meaning the bracket has its own little door or clip.
Precisely. No need for the separate elastic tie.
Okay, so thinking about it from a sales angle, phase one feels like it's a lot about that first impression for the patient, yeah.
Oh, absolutely. It's all about comfort. How the brackets look. Are they clear? Are they metal? Aesthetics matter here. The overall design of the system. That's what the patient sees and feels right away.
So knowing about different bracket materials, ligature colors, that kind of thing is important here.
Definitely relevant for that initial conversation.
Got it. So once that initial alignment, that leveling is underway, what's the next big step?
That takes us into phase two. Bite correction and space closure. This is often called the main working phase. This is where the orthodontist tackles let's say, the bigger challenges.
Bigger challenges like, what are we talking about?
Well, this is where they really fix how the upper and lower teeth fit together. Correcting bite problems like a class 2, where the upper teeth are too far ahead of the lower, or class 3, which is the opposite. The lower jaw is too far forward. And it's also where they focus on closing up any gaps, maybe gaps from having teeth removed, or just spaces that might have opened up during that first alignment phase.
And product-wise, how does this phase shift from phase one? What changes?
You're definitely moving to stronger, stiffer wires.
Yeah.
Usually rectangular ones now, maybe stainless steel, maybe a stiffer NiTi wire.
Yeah.
And this is where doctors start using a lot more.
Auxiliaries.
Auxiliaries,
Yeah.
like extra tools. Yeah, things like elastics, the rubber bands patients often wear between their top and bottom teeth. Or maybe coil springs to push teeth apart or pull them together. Power chains too, those connected elastic rings for closing spaces. And sometimes specific appliances designed just for fixing those class 2 or class 3 bite issues.
Okay, this sounds like where the technical specs really start to matter for a rep.
Exactly right.
Yeah.
Product performance is critical now. Understanding the details of your bracket prescription, things like torque, which is about rotating the tooth root, that becomes really key. You need to know what specific movements is the doctor trying to achieve, and how do your products, your wires, your brackets, your auxiliaries help them do that. It's definitely the most technical phase in terms of matching product features to the doctor's plan.
Okay, so after all that heavy lifting, the bite's corrected, spaces are closed, what's left?
Then you arrive at phase 3, finishing and retention. Honestly, the smile probably looks great at this point. But the orthodontist is now doing the fine-tuning, really dialing in the occlusion.
Occlusion meaning how all the teeth bite together perfectly.
Precisely. How all the points and cusps meet just right. They might use, say, braided stainless steel wires for those final tiny adjustments before they take everything off.
And then, the moment everyone waits for, braces off. But it's not quite over, is it?
Definitely not. That brings us to retention. So appliances come off and retainers are delivered. Could be those clear plastic trays, maybe thin fixed wires bonded behind the front teeth, or the traditional Holly retainers, the plastic and wire ones. And here's the maybe the most critical takeaway of the whole thing. Retention is non-negotiable. Seriously, teeth have memory. They want to drift back.
Ah, so without a good retainer plan...
All that beautiful work can just relapse,
Yeah.
even after perfect treatment. Consistent retainer wear is absolutely essential for long-term success.
Okay, let's just quickly recap that flow then.
Sure. Phase 1, align and level. Think light wires, getting things straight, basic tie-ins. Phase 2, correct the bite, Close the spaces. That means stronger wires, auxiliaries like elastics, coil springs, power chains,
Mm.
more technical. And phase 3, finishing touches, detailing the bite, and crucially, retention using various retainer types.
Right. And each phase clearly needs different tools, different products, and for you listening, different points of knowledge when you talk to the doctor.
Absolutely. And that leads to a final thought, something for you to kind of mull over as you learn more. Retention isn't just about that last appliance you sell. If you understand your doctor's philosophy on retention, what they prefer, how strongly they emphasize it right from the start, that understanding could actually shape how you talk about product choices and what to expect throughout all 3 phases.
Interesting. So knowing their end game helps frame the whole conversation.
Exactly. Think about how knowing their retention preference early on could make your entire sales approach even stronger.